Now let's talk about the laparoscopic adjustable gastric band. It was the second surgery that I added to my armamentarium of weight loss surgical tools, I think in 2003. I'll be honest with you, when the lap band first came out, I was a little reluctant to go to it because unfortunately what I had been taught, what I had been trained based upon gastric bypass was that purely restrictive surgeries can't work. And that conventional wisdom, which is not uncommon in bariatric surgery, turned out to be wrong. Purely restrictive surgeries can work just fine. You just have to know how they work. The principle of the lap band is not complicated. It's a rigid ring, silicone, or rubber if you want to think about it this way, but technically it's silicone. So the outside of the ring is rigid, and on the inside of the ring is a balloon. And this mechanism opens up so that the balloon connects through this tubing to an access port, and we can poke a needle into this port, and with a syringe and salt solution, saline, we can put fluid into the system. Well, if we put fluid into the tubing, it's going to go into the balloon expands, and the diameter of the ring shrinks. If we get, a little too tight, we can take fluid out of the system, the balloon deflates, and the diameter of the ring increases. And this is a model of your stomach, just in case you didn't know, and we put the ring, and it's pretty anatomically correct in terms of location. Your actual stomach, capacity-wise, is larger than this looks because it stretches. This material doesn't stretch, but your stomach can stretch a lot. Anyway, we put this adjustable ring on the upper portion of the stomach, leaving a little bit of stomach above the band and almost all of the stomach below the band. This is your esophagus, which connects your mouth to your stomach, and this is the first part of your small intestine. And it turns out each individual patient has an adjustment diameter which, I don't want to say perfectly, but ideally fits them. And by which they get good, dependable restriction, meaning they get a full signal. Remember my lecture about your disease, that's the primary thing you're missing, in my opinion, is the ability to experience full, to get full when you eat. So you have sustainable, reproducible, built-in portion control. And the key to all of this is one of the keys is having dependable portion control. That's what the lap band provides, is a full signal. And there are some additional things. I notice when people are adjusted right, the overwhelming majority of them, I call it the loss of food obsession. They'll just notice they go through the entire day and the only time they think about food is when their stomach gets hungry, when their stomach growls or sends them that physical cue that I need to eat something. Imagine going an entire 24 hours and the only time you think about food is when you need to put something in your stomach because it tells you so. Loss of food obsession. And patients who experience that, it's a very powerful addition to the full signal that you get with the lap band. The seed I want to plant today with the lap band is not so much how it works, but how it doesn't work. There is a lot of bad information out there about the lap band, and honestly, you don't have to go far to get the right information. The company, Allergan, that makes the lap band, which is what I produce, and the other company, Ethicon or Johnson & Johnson, which makes the Realize band, it put out the same information. The basic misperception that a lot of surgeons and almost all patients have about their band is if tight is good, tighter is better. And that is wrong. And if you look on the material, the educational material that the company gives, it gives a spectrum of adjustment. Too loose, just right, too tight. Guess what's the worst thing that happens to somebody when their band's too tight? Not does it hurt when they swallow because things get hung up as they go down. Not only are they regurgitating things today when they belch that they ate yesterday or 2 days ago, not only are they suffering with terrible reflux, heartburn, not only can they not eat the foods they really want to eat, when your band is too tight, you don't lose weight. Now you would think it's exactly the opposite, right? That if my band's so tight I can hardly swallow, I'll lose weight. Great, yeah, I'll suffer those other indignities, but at least I'll lose weight. And you would be wrong. When we make your band too tight, all we have done is turned you into the old stomach stapling, which I talk about in my educational lecture. What was the horrible thing about the stomach stapling? The band was too tight and people couldn't eat the foods we want them to eat, so they could not only get full but stay full. So they end up living on mush, goo, high-calorie liquids. They end up consuming more calories, not fewer calories, because they can only eat such a small amount at one time. They're hungry all the time. They may get full, but they don't stay full. So the key to your lap band, think about it differently. The key to your lap band, again, going back to my fundamental principles, menu and exercise, those are the keys to your success. Being able to eat off the menu that we want you to eat, get full when you eat, and exercise and become physically active. Well, if we've got your band too tight, you can't eat that low-carb sort of Atkins kind of diet that we want you to eat. If we've got you too tight, you can't eat the meats, you can't eat the good proteins, you can't eat the good starches, the good vegetables, you can't eat the good fats. They won't go through. Or if you can eat them, your band's so tight, it takes so long to eat, you just don't want to try. Or you can't eat a large enough portion size that you not only get full, but stay full for several hours. So the first key with your lap band is to not lose the ability to eat off the menu we want you to eat off of. And then the other key, like I said, is we're going to reduce your calorie consumption. Typical lap band patient, when they're adjusted right, their portion sizes are about half, maybe 40% of what they used to eat without their band. Not a tenth, not an eighth, about half or a little bit less than half. So you're going to eat off the menu and not only get full and stay full, but you're going to exercise as well. That's the key to the band. When it comes to the band, the sleeve gastrectomy, which I'll talk about in another video, usually that's the debate that people are having in their minds. Should I go with the lap band or should I go with the sleeve gastrectomy? And again, like I've said before, all of these surgical tools are excellent tools. None of them is perfect. None of them is a cure in and of itself. I just tend to find that people tend to neatly fall into either the band category, they're a band kind of person, or the sleeve category, they're a sleeve kind of person. What makes somebody a band kind of person, personality-wise, belief system-wise, comfort zone-wise? I think the key to it is reversibility. People who tend to be band people, and I'm this way, very much so, they don't like to burn bridges. They like to keep all their options on the table. Heck, some new and great technology may come along 5 years from now, 10 years from now. If I have a band and I want that new technique or technology or treatment or medicine, whatever it is, I can have this thing removed. I can essentially have it completely reversed. That's the typical band personality that I roll across. People who that's sort of their number one priority, to not burn bridges, to not make irreversible decisions, if you will. The only other thing I would want you to understand about the band, because it is a device, devices can have issues. They can break, we have had no bands out of 1,500 bands, the actual band itself break. We've had a handful of folks, literally 4, 5, 6, that we had to replace their port mechanism, and this actually comes apart here. This thing's changeable. But really, in the big scheme of things, we have had a very low device-related issue. The thing about the band is, because it's a device and because it's adjustable, it's not the most user-friendly of the surgeries that I offer. You got to come in for adjustments. If we get you a little too tight, it may happen at an inconvenient time. You got to come in and have some fluid taken out. It's not a zero maintenance approach, and don't kid yourself. It's not have my band, get 1 or 2 adjustments and be done with it. It's have my band, go through a learning curve that takes a few months, typically takes 3, 4, 5 adjustments, takes 3 to 6 months to get comfortable with it, and then understand that every 10 to 18 months you're going to need to come in for a touch-up adjustment or a touch-up visit, because you'll tend to forget this stuff if you don't continue to come see us. But that's the story on the band. No question, it is an excellent weight loss surgery tool. No question, we have helped people get results just as good as they would have gotten with a gastric bypass, or just as good as they would have gotten with a sleeve gastrectomy, and some of them even better, because they don't have the issues that go along with those other surgeries.